Good afternoon. How's everyone doing? Good. So full disclosure, it says Dr. John Collier. I'm not actually a physician, but Jeremy is a doctor.
Not a real doctor. Not a real doctor.
Yeah. Yeah. But so happy to be here today, guys. We're gonna. Yeah.
Off to a good start.
Yeah. No. I would say he's a real doctor.
Yeah. I got my doctorate in medical anthropology, so I worked very hard at becoming completely unemployable. Unfortunately, it didn't quite work out. Spent about 10 years in public health before joining Proactive MD.
Right. And we're happy to have him. Well, I'm the president and CEO of Proactive MD. We are an employer-sponsored direct primary care on-site, near-site clinic. And so today I want to ask a question. Does anybody here work with employers? Okay, a lot. Is anybody here doing care outside the walls of primary care, direct contracting, getting into strategies such as that? Okay, handful. Well, that's what we're going to talk about today, about care that goes beyond the four walls of direct primary care. But the key thing I want you guys to keep hearing over and over and over again is none of it's possible without you, the primary care physician. And so we are all here. We're all very, very passionate about it, but our vision at Proactive MD is to elevate the standard of primary care. We want to remove the obstacles to care and reunite the patient and the physician relationship. We work with large employers all over the country, and we are committed to taking care of their people, those employees, and we're committed to working closely with those patients because we know that each and every one of them are a mom, a dad, a brother, son, and a daughter. And so that's what we're here to do, is to provide the best of the best care. And so we've heard lots of people talking today, and we want to reiterate and say the same thing. Guys, at the direct primary care level, we are in such a unique position to be a full scope solution. When you have physicians and practitioners that can practice broad scope primary care, it's a powerful, powerful thing. We want to come together and empower physicians to practice at the top of their scope. And we want to support that team. So in our model, we have a role called the patient advocate that works side by side the physician. So many times you hear the physician and you hear people selling, our doctors will do X, Y, and Z for the employer population. And we believe the physician can do a lot, but we want to give support. We want to build a care team that can support that. And so our patient advocate are licensed masters of clinical social work, and they work on many things such as the social determinants of health. When we talk about care beyond the walls, we want to even think about the care before they come into our walls, our four walls of the clinic, and how we take care of those people. What's going on at home? What are some things on the home front that are may be causing obstacles to care and meeting people right where they're at? And this patient advocate also works on the back end, right alongside the physician, to focus on care coordination, to focus on on behavioral health situations. And we're going to talk a lot about them as we go, but they are a key component. And then you see on the slide that care beyond the walls piece. So before the end of this presentation, you're going to probably hear the words care beyond the walls a million times. We're very, very passionate about that at primary care. We're very passionate about leveraging primary care through the continuum.
So those of you who raise your hand and work with employer populations know that employers, they want to provide outstanding care to their employees. They want to provide a great benefit that'll help with recruitment, retention, but it's an investment, and it is a huge investment in a lot of cases. And employers are right to then want to understand what are they getting for the money that they're paying, whether on a per member per month basis, or with these larger contracts. Everything comes down to service. So it's service to the patients, service to the employer, who is the customer for a group such as ours. And so part of that is making sure that we're working together with them to have guarantees put in place that we're putting our money where our mouth is. So we put fees at risk on that we're going to hit certain metrics, including one of the ones that's most important for employers, but probably makes a lot of the physicians in the room, I would imagine, cringe, and that's what's the return on my investment. So what's important is not to think of that just in terms of, well, the financial return, we're going to lower your PMPM claims experience by X number of dollars, but it's also understanding that that is a downstream output that's coming from providing the fantastic, high-quality care, the optimal care, and helping people get healthier. So we place our guarantees around that as well as we do, because if we focus on those things, if we focus on making people healthier and making the population healthier, the savings will come. And it's broken. Imagine, if you will, a slide. Sorry.
So we're all here to talk about advanced primary care, direct primary care, again, elevating that standard of primary care. And in our model, and many of your guys' models, you work with employers, they're looking for that. They're looking for solutions. So we've been doing this for over 5 years now, working with employers, and I continue to see the marketplace develop. I continue to see employers opening and being more and more open to different strategies and looking to the primary care physician for help. And I mean, as you all know, the cost of care continues to rise. And our job is to focus on strategies that can directly impact the cost of care. And to do that, we have to have a unique care team driven by the primary care as a quarterback, but again, building a robust care team that can support that.
And you keep hearing data-driven. I don't just work the clicker here for John. I'm over the data and analytics for Proactive MD. So data, I live and breathe. I'm chief nerd here. Everything that we do at the company has to be driven by data. It absolutely has to be. And one of the things that we use that data for is trying to identify, I kind of hate the phrase, high-cost claimants. That's how employers, that's how plans, that's how consultants are referring to this group of people, for whom we heard multiple stories this morning. They're your people who are chronically ill, who have diagnoses of complex conditions, cancer, musculoskeletal issues. As physicians, it's understanding how do we use that and understand who these people are to bring them into care, because that care has to extend beyond just, well, hey, I unfortunately made a very grave diagnosis with you this morning. I'm going to release you back into the system that I started my DPC practice in order to try to improve and to change. So it's remembering that you're their physician throughout all that process, and that will be a very difficult process. So being able to guide them and actually take ownership over your health outcomes and sending you to the highest quality providers and facilities, that's part of my job as a physician and part of our job as a larger care team and community to be able to do.
Do you recognize the words care beyond the walls? As you can tell, we're very, very passionate. That's our mantra. We have a trademark because we believe in it so much. Because when we partner with employers, we want to look at the employer in the eyes and say, we are your true partner. We are in this. These are our patients. Whether that patient ends up in the hospital or that patient ends up in a specialty facility, those are our patients. And we want to empower physicians and to be a part of the whole continuum of care. We want to bring those patient advocates alongside and the physicians alongside to take patients by the hand and walk through the complexity of care. You guys, so many doctors here, so many healthcare professionals, we all know how complex this system is and how so many times, I talk to patients all the time. One of my favorite part of my job is going to our health centers and spending time with our patients. And one thing that is so hard, I'm sure you guys see it every day as physicians in the front line, how easy it is for these patients to lose hope. They were diagnosed with diabetes, maybe they're diagnosed with cancer, or a family member was diagnosed with something really scary. It's not even just that disease type, the complexity of healthcare in our country is so scary to people. And so our job and what we want to do with employers is we want to come alongside of them and we want to facilitate healing experiences by restoring hope and by bringing some clarity to healthcare and walking through this path with them. And to do that, one quick thing, to do that, it's got to be built on a foundation of primary care. None of this can happen without each and every one of you as primary care physicians. So Smart Care Medical Center Network, something, traditionally when you're working in the employer space and you're going against other on-site clinic vendors and different things, everyone's focused about primary care, and it's great. There's a lot of things that can happen at the primary care level. There's a lot of great things we can do at the primary care level to bend the cost curve. But something that people don't hit head on is high-cost claimants. And we shy away from that. We never want to do that. Again, we're partners. We're committed to getting patients the right care at the right time in the right place for the right cost. And so we've partnered with a group called Edison Healthcare. Edison Health was built by a gentleman named Tom Emmerich, who's a dear friend of our company. And Tom ran global benefits for Walmart for years and years. And while at Walmart, he was very focused on half a dozen or so catastrophic claims and what was going on. And so he used Walmart's data and a lot of other data points to say, where's the best in the country? Where can I get the very, very best, clinically excellent? That's the main focus on the quality, focus on the clinical outcomes. And then he took Walmart's leveraging power, which they have a lot, as you guys know, and went out and contracted. And so now, when we're working with our employers, we wrap Edison over everything. And so we work with our patients to, when appropriate and when needed, to get patients to the Mayo Clinic, to get patients to the Cleveland Clinic, or wherever we feel is best per the data and per the physician's recommendation to go for that patient. And the great thing is, per that contract, we have open communication with that cardiothoracic surgeon at the Cleveland Clinic. And so when they come home, we work right alongside with them. The patient advocate can coordinate all that travel, all the care, and guys, it really, really bends the cost curve for these employers. So different strategies. Again, I saw a couple hands go up that people are doing direct contracting and working with employers to think beyond the walls. Some strategies that people are working on, something that we do a lot is a network audit. So there's a lot of talk, social media, people talking about drop the network, don't use any BUCA plan, and I'll cheerlead for that as well. That's great, but not every employer is ready to do that. We push and we can try, but they're not. If they're going to stay with the BUCA plan, we're going to make sure that network is maximized, that we use data, we use the tools that we have to make sure that we are coming alongside those patients, taking them by the hand, and getting them that right care at the right time in the right place. And so we audit those networks, and we say who's the best of the best, and then we send them accordingly. Reverse referrals, using that same data and identifying where patients are going. We'll see, some of our patients, maybe a hypertensive patient is seeking care at a cardiologist. Well, that can be done at the primary care level. So we have open and honest discussions with those cardiologists, and we refer back into working with the patient to come back and seek that care at the primary care level. Direct contracts, and I know that's been a popular thing in the DPC space for a long time now, and many of you are doing a very good job of doing that. There's a huge opportunity out there. So doing direct contracts for screening centers, radiology, endoscopy, pathology, laboratory, there's a lot of things you can do, and there's a lot of groups that are willing to work with you on that. Reference-based pricing. Who here has heard about reference-based pricing in the last few years? A lot. It is something that we're hearing more and more and more about. I love it. I think it's a great concept if done appropriately and if done in the right marketplace. It doesn't work everywhere. And so when that patient's balance billed, that responsibility, I believe, falls back on the primary care to advocate and help. So I believe reference-based pricing is a good strategy to work with. There's a lot of consultants out there doing it. Great. I cheerlead for it. If it's done appropriately in the right marketplace, keep in mind, they need you all to do it. They need primary care. They need the care coordination that you all bring to the table to do this. Lastly, is building a complete network. So we work with employers who are ready to just say, you know what, we're going to get aggressive. We're going to drop the network completely, and we want to build our own lean, narrow network. And so lean, narrow network, high performance, we've heard these terms for a long time. It sounds great. It doesn't work without primary care, patient advocacy, the care coordination that comes with that. And not just care coordination of, I'm going to refer you here, care coordination of sometimes picking the patient up, our patient advocates pick them up and take them to care. Having open relationships that when our patient's headed to the ER, that they call the doctor first, and the doctor can say, maybe they can divert care altogether, or they can say, no, that ER is not a network. Having that type of relationship.
So this is Amber. She's our senior patient advocate. As a data practitioner, analyst, my favorite meetings every week are with our patient advocates, because these are social workers who want nothing more than to help the patients that they serve, work alongside, joined at the hip to the physician And they really see the value of the data and what it can bring to understand, how do I bring those people who have hypertension, diabetes, who have experienced a cancer diagnosis in the last few weeks, who suffered a stroke, how do we bring them into care and be able to help them navigate the next steps? And so working with our patient advocates is just an extremely gratifying way for us to see the data that we're collecting, whether it's financial data, clinical data, risk data, turned into action that is actually going to improve somebody's health outcomes and their overall quality of life. So the patient advocate is one way that we use data. We also believe very strongly at Proactive MD that if we're going to make the outcomes happen that we are guaranteeing we're going to happen with employers, we need to make data available at the point of care at all times and be very transparent. So our physicians have access to tools which help them see who are the highest quality providers and most cost-effective providers within the community. What are the best facilities to send somebody for a colonoscopy or an arthroscopy? And helping them understand what else is going on in their patient's life that they need to be aware of. ER visits that weren't mentioned, things like that, so that they can help direct them to the best clinical pathway. Having access to that data is crucial. Our account managers, of course, anybody here raise your hand if you ever have to deal with things like utilization metrics, capacity, visit count, right? Those of you who are running your own practices understand that that is a burden, but it is important because you have to make sure you're running an efficient clinic for your patients and that the right people are able to get in, have access to that care. And lastly, the employer. We believe very strongly in transparency of data. I worked in government, so you know I'm incapable of lying, obviously. But we make data available to our employers, de-identified, but so that they understand what's going on with their patient population and their, let's be honest, their investment in an on-site, near-site, shared-site solution.
Guys, I want to talk to you. One thing I want to encourage you all, even since the first HINT Summit, I've seen this marketplace shift. And employers, just like I opened up with, they're hungry. They want solutions. And you guys are it. They can't do it without you. One thing I would encourage you is ask for proof. There's a lot of consultants out there. There's a lot of different strategies out there. They're saying things on social media. There's a lot of chatter. They can get 60% of Buca rate networks or way sub CMS contracts. That's great. I love it. Ask for proof. And guys, know that it's on the primary care. Everyone needs you all. And so thank you so much
Thanks for your time.
Appreciate it.